Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, it's 1 year since the passage of the National Health Care Law, what's going on with that, plus a review of Governor Corbett's budget and its relationship to health care in Pennsylvania. Also in this fact-filled show, the energy future in our country and our state, given Japan's nuclear disaster, all of that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. I forgot to say Pennsylvania politics and government in depth and in detail, and it all starts right now. Well, the host, you know, who knows. Here's a guy who never forgets anything. Sitting across from me, Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. I don't know what it is. I got into this. I was thinking about what I wanted to talk to you about.
Good morning, Terry. It's nice to see you.
Good morning, Stuart. Great to see you. All right, look. I want to get to Governor Corbett's budget and its impact on health care in our state. But first of all, 1 year, talk about what you like and what you don't like about the National Health Care Law as you've seen it play out over this past year.
We know that it's going to put enormous mandates on people and on government, and it's going to be very expensive. We know there's some federal dollars in it now, but a few years from now there's going to be a cliff and they're going to go away. I think that it has a lot of great components in, but I think it needs a lot of fine-tuning before it's implemented. And I think that we know that in Pennsylvania it's going to add 750,000 people to the Medicaid rolls in just 3 short years.
And may I interrupt you and ask you a question about that before you
Sure.
move on? Is it also true that the federal government's reimbursements to states on a formula will change and the states will get less money as it now stands?
Oh, they'll get some money for the first couple of years, but then it falls off a cliff. And no one is looking ahead on what are states going to do with all of these mandates down the road. And we're looking at 25% of Pennsylvanians being on a state and federal government supported health insurance program.
Well, we're in the midst of this recession with the state with a $4 billion deficit.
Yeah, it has good components in it.
Yeah,
and we've always talked about that. But it's a little bit too much, too fast. And I think Governor Corbett is quite right in saying, hey, guys, let's slow this process down.
Right.
Let's make sure it's legal. And in the meantime, trying to implement it in a reasonable and fair way.
Well, I'll tell you, I know you're not a lawyer, but if this case that, you know, more than, 26 states are involved in a couple of lawsuits, ends up in the Supreme Court and the whole thing gets chucked out, the mandate part, you know, the requirement that everybody, I mean, that could reap, I mean, then where are we? I mean, you guys, you got to deliver the services. You're the folks who are on the front lines of all of this.
Well, there's a lot of tragedies with this. It's got a lot of good. I don't want anybody to take that away. But it takes money away from the frail and the elderly in order to pay for the expansion. And as you know, I care mostly and I advocate for the elderly in Pennsylvania.
That's correct.
And it's on balance, this law has good things, but it's also a real risk to the care of the elderly down the line.
All right, let's go to Governor Corbett's budget. As you know, a $4 billion deficit. The governor has said no new taxes. He has stuck to that pledge to this point. However, the budget does have a huge impact on health care. Talk a little bit about that for our viewers.
Sure. Let's first talk about the elderly, who I care most about. In fact, you and I are getting there. We just want to make sure this. That's right. The budget does something that's very wise. The governor has said, let's stabilize, because under Rendell, expenditures went like that. The governor has said, prioritize.
Right.
And he's quite right. He's saying, let the must-haves, the services that we need to provide, be provided first before we go to the nice-to-haves. Now, some of the services to the frail and the elderly, especially in nursing homes, are cut a little bit. And the nursing homes who care for the frail and the elderly, and I'm using them as an example, have in the governor's budget about a 1.5% decrease in reimbursement. And the nursing homes have taken a big hit. The elderly are not saying, treat us special. Right. They're just saying, treat us fairly. And so the providers who provide care to the elderly, whether it be doctors or hospitals, under Medicare and under Medicaid, just are asking to not be dug in any deeper as priorities are discussed. So the reality is, I think the governor's budget does set priorities, and I think it's about time in Pennsylvania that we do that. Respect the frail and the elderly. Give the services to them that they need. And stop providing all those non-mandated services that grew so exponentially under the Rendell administration.
Yeah, I want to go also to the nursing home situation, which you know best. But before I do that, we have about 45 seconds left in this segment. Give me an example of some of the services that you think, you know, they're nice if we could afford them, but we can't. Does that mean sort of optional treatments that
It means several things, and I hope we'll get into it in the second segment in terms of the need for tort reform.
Okay.
But in terms of the services to the elderly, the frail and the elderly need nursing home services, and they need them with dignity.
Right.
But what the state shouldn't be paying for right now is any growth in home services, because those are not mandated by the federal government. Most of those services are provided to people whose families and friends have historically provided to them, but we've seen enormous growth of that.
So your point is,
over the last couple of years.
if we're required to do something, if state and federal law says you must do it, that should be funded first, and the optional things last.
Absolutely.
Okay, we're going to run to break. We're going to come back. We have a couple of other important items to take up following, guess what, these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're talking with Dr. Stuart Shapiro. We're 1-year anniversary of the national health care law. It remains enormously, vigorously controversial. Some folks for it, some folks against it, some want it repealed, some want it tweaked. I think my friend here wants it tweaked. It's all right. You're okay for tweaking it, right?
Significant tweaks.
He wants a significant tweak to it. Okay. Look, we were talking about these mandated services. But certainly one of the drivers of healthcare costs has to be what I hear from so many doctors, defensive medicine, their concerns if they don't do A, B, or C, they're going to end up in court. Talk about that.
Well, let's talk about it both at the state and federal level. The first issue is we've been talking about healthcare reform. The Congress, the Senate, and the House in Washington punted on the issue of tort reform, and that law contained no tort reform. Now switch to Pennsylvania. If you look at ratings by the Fair Justice Foundation, some of the business, the chamber, they will tell you that Pennsylvania rates among the worst in fair-minded tort lawsuit basis in the country. This is such a friendly place to trial lawyers filing trivial suits that if you drive around and you look at billboards and newspapers in Pennsylvania, they're advertising, they're trolling for clients. And I'm going to give you an example. There's a law firm out of Florida, a law firm that's been sued in Tennessee and paid $4 million for overcharging clients, is advertising in newspapers to get cases. Then what they do is they get people playing on people's fears. They sign up for these cases. They file cookie-cutter cases. By that I mean cases that simply use the same words. They put on new cover sheets. Then the hospitals, the nursing homes, the doctors have to file reams of paper to answer that. And that takes time away from patient care. It's very costly. They don't usually win these lawsuits. Yeah. All they want to do is settle. They roll the dice. They roll the dice to just try to get some money. Now, this firm was in Florida, which is where they live. It so drove insurance companies out of Florida. It drove healthcare providers out of Florida, that the citizens revolted, went to the legislator and said, let's have some tort reform. Tort reform was passed. Now this firm goes elsewhere, and they're coming into Pennsylvania. Right now, the legislature is considering some tort reform. The governor's for it.
Supported it during the campaign.
And we ought to get some real tort reform in this state soon.
Okay, now under this whole rubric of lawsuit abuse reform, which we're talking about, there's also this issue of whether doctors and people in the healthcare system can apologize. You know how important that is. You know, doctors have been afraid just to go and say, I'm sorry, here's what happened, because it could be used against them. That's also, I think you would agree, a step in the right direction, correct?
It's an important step. In fact, that legislation recently passed the House.
Right.
The governor, I'm sure, will sign it. Needs to pass the Senate. 37 states have it, all the states surrounding Pennsylvania, and all it does is lets a doctor go up to a family and say, I feel badly, let's talk about what happened.
Yeah.
Because families are not looking for money, they're looking for some what happened. This will let doctors and nurses and other people do that, and it ought to pass, along with the Fair Share Act and other pieces of legislation.
I think the other thing that's sort of important, and I've heard this from physicians, you know, we have all this modern technology, and true, it's saving a lot of lives, it's a good thing. But also, because doctors are so fearful, I think, and, you know, the medical community in general, of being sued, that you'll go and you'll get 3 or 4 tests that otherwise they might not utilize. The technology's there, why not use it? And so that also has to help drive up costs, because they're concerned if we forget to do test A and B, you know, it's got a 10% or a 20% chance that the test will show, but let's do it because, no? Am I on the right direction?
And we know that because you know it, because it's happened to you.
Absolutely.
It's happened to me, and it's happened to every one of the viewers. Their kids get extra tests when they go to an emergency room. They get extra tests when they go to the doctor. And the federal health care law pays for volume.
Yeah.
And so no one wants to control this.
Before I let you go, I mean, let me just ask you this, a big question. I don't know if I ever asked you this question before. You know, we have this aging population. We're the 3rd oldest state, oldest population, 3rd oldest in the country. People stay here. They even come back from Florida and other places to sort of live out their last life because of the pretty good benefits. Now, here's my question to you. What is this doing to the pressure on nursing homes? How do you think this is going to play out in the next 20 or 30 years with all these baby boomers retiring, you know, living longer, getting illnesses that you can't take care of in the house anymore? What's Stuart Shapiro's long-term view of this?
Well, I think we ought to do a whole show on this, because it's how do people plan to pay for their services.
Let's do that.
Where are they going to get these services? Nursing homes are important, assisted living, as is home care.
All right,
but that's the kind of question we ought to really be discussing.
We're out of time, but you're coming back. We're going to do that. I think that's a question. You know, we never say we look long-term. We always look next year. But, I mean, just like we do with Medicare and Medicaid and Social Security, we never look past next year. Well, we're going to look past next year. We're going to talk about now the energy situation. How is what's going on in Japan going to affect our state and the nation? We have a great guest coming up. Back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, let me tell you, we couldn't have a more important subject to talk about than energy, and we're going to get into that with Terry Fitzpatrick. He's the president and CEO of the Energy Association of Pennsylvania, former member of the Pennsylvania Utilities Commission. Terry, as always, we got Terry and Terry here. We'll work our way through that.
Gets confusing.
Yeah, it does. All right, look, let's start. 20% of our power in our country is nuclear. We have, 5 nuclear power plants here in this state. We're a big energy-producing state. We got that. We got that. Now there's a debate about nuclear, where we go with it. We got this huge, sitting on all this natural gas. Give us an overview about, what you think this nation needs to do to stabilize its energy and obviously move away from fossil fuels. I don't think no one seriously questions that. Go ahead.
I think the key point, Terry, is that all forms of energy have their benefits and their drawbacks. We do have a lot of nuclear energy in this state. When it comes to electricity generation, we're blessed in this state. We're probably the leading exporter of electricity in the country. And that's because of our nuclear plants, it's because of our coal plants, and also now we have a lot of natural gas plants. And probably the trend is towards natural gas, particularly with the Marcellus exploration, the amount of production coming out of that.
So you think eventually, well, natural gas, I mean, obviously we don't run our cars by that. I guess they're doing some experiments. I'm now getting way out of my field.
Well,
here.
there is a trend towards using natural gas as a transportation fuel, and that's something some of our members, the gas utilities, are really promoting now, particularly because gas prices are stable or going down, natural gas prices, but petroleum prices are going up because of all the unrest in the world. So I really think there's a good case to be made for investments in infrastructure to make compressed natural gas vehicles more prominent in the state.
And that's one of the reasons why we're sitting on this huge cache of natural gas in Marcellus Shale. As you know, that has its controversy about whether to tax it or not, what to do about the cleanup. It's complicated. But I don't think there's any doubt that the state is committed to assisting, in different ways and promoting the extraction of natural gas and its potential for employment in the state. I've heard 50,000, 60,000 jobs. Yes, no?
Well, that's correct. And it's interesting that this isn't a partisan issue. I mean, there's a lot of differences between
taxing, maybe,
between the Rendell administration and the Corbett administration. And yes, there was a difference there on the position on taxing, on a severance tax. However, both of the administrations recognize the importance of this natural gas industry in the Marcellus to Pennsylvania. And, so it really isn't a partisan issue.
Mm-hmm. What do you, I mean, do you think that, and I don't, why not? You've been put in the spot for a long time. I mean, that's what you do.
I'm used to it.
Pennsylvania, on the Utilities Commission, you got to make all those big decisions about rate hikes and regulations. I mean, what do you think ought to happen with nuclear? Do you think that, we haven't built a plant, like in 50 years? Now there is some, moving it through the Nuclear Regulatory Commission is complex. Do you think we ought to stop all of that completely? But, I mean, what's Terry Fitzpatrick's take on that?
No, we clearly shouldn't stop it completely. There are reviews going on at several different levels with regard to what happened in Japan and what it means for plants here. The Nuclear Regulatory Commission has people over in Japan actually monitoring that. They're doing a review of their safety standards here in the U.S. Really, what I think we ought to do is, I think nuclear is good. It's a very important part of what we have now. We ought to let the market decide what gets built. And the market right now is pointing a lot towards natural gas because of the lower price of gas and because it's easy to get those plants built and up and running.
Yeah, I want to ask you about gas pipelines and some aspects of that. That's pretty important, and we've got to get straight, and you're the guy to talk with about that. But before we do, I mean, but there's certainly nothing wrong with going into these plants and doing reviews of them and making sure that they're upgraded and safe. I mean, the nuclear plants I'm talking about, that only makes sense, doesn't it?
Oh, absolutely.
Who can be against that? All right, we got natural gas pipelines aging. I mean, there's been an explosion or two. I want to talk with, I can call him this, Commissioner Fitzpatrick. Once you're in, you're always in. You never get out. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, thanks for coming back. We're talking, look, 11,000 miles of aging gas pipelines. Why should we care about that? Now, I know you're going to tell me. Why should we care about that?
Well, I think it's really part of our bigger infrastructure issue in our society generally. We have issues with infrastructure. In some cases, we have bad problems, particularly when you look at our roads and bridges. But we need to modernize our infrastructure, and we need to pay more attention to that than we have. The recent gas explosions probably illustrate that and have gotten a lot of attention to it.
Now, is that because of the aging pipe? Are these pipelines that just deteriorated?
The exact causes of the explosions in Allentown and Philadelphia are still under investigation. We don't know the causes of them, and I'm not going to speculate. Statistically, the number one cause of gas explosions in the country is excavation-related incidents where, for example, a contractor would hit the line while digging up the street.
But then what's the importance of the aging? I mean, in particular, when you talk about that, is there, because we have so much of it, because it's so assessed, you know, go ahead, take it.
The older areas of the state, the established towns and cities, tend to have more of the older types of pipes, which are cast iron and bare unprotected steel. About roughly 25% of the gas pipelines consist of that older type of material. Pennsylvania is not in any way unique in that way. If you look at the entire northeastern part of the country, almost all the states have right around a quarter of their infrastructure in that older material. It is being changed out now by the utilities that own them. What we are advocating as an association is that the Commonwealth ought to do more to allow the companies to get their money back more quickly and with more certainty so that they have the incentives.
What's that mean, get the money back more quickly?
Well, there's some rate-making reforms that are needed, we believe, in the way the Public Utility Commission handles this. Right now, you have to go in for a rate case to recover that money. There's a 9-month time period that's necessary to process those cases, and if you make the investment, you never catch up with that. It's something called, the term that we use is regulatory lag. 18 other states have a different type of rate mechanism to allow companies to get the money back more quickly, and
so
we
you're
believe
saying
Pennsylvania
the money
should
would
have
be
that.
available if they could expedite it, and then you could get into this business of replacing these aging pipelines more quickly and ensure, you know, there's a safety component here, you think, as well as need just to do it.
Well, I want to make sure that I don't oversell this. There are safety regulations that are out there now. A unit of the U.S. Department of Transportation issues regulations that say you have to inspect your system, you have to take care of risks. But any time you modernize, it has a number of benefits, and one of them is you have more resilient pipes, and that has a safety benefit as well.
Great update. We'll get you back. I want to talk about this Japan nuclear and all this. We'll get you back here and we'll chat a little bit about that. All right, as always, thanks for watching the program. And guess what? You all stay well. And we'll stay here.